Breast cancer is often perceived as the #1 killer of women, but the reality is it's cardiovascular disease that claims the #1 spot. The majority of women between the ages of 40 to 60 have at least one risk factor for heart disease, but the scary thing is that many don't even realize it. Joining me now is Dr. Lisa Freed, the Director of Women's Heart and Vascular Program at Yale-New Haven Hospital. Doctor, thank you so much for being here.
Thank you for having me.
So are women at a greater risk for heart disease than men?
Yes, they are. As you already said, cardiovascular diseases are the #1 killer of women, and since about 1985, more women than men have been dying of heart disease.
Why does that surprise me? It does, though. I typically feel like it's men that are having heart attacks.
Right. For years and years, that was what the society believed and what the research had showed. And around 1985, the American Heart Association realized that actually the number of women who were dying from heart disease was starting to rise and had surpassed men. And the American Heart Association started a campaign really about a decade later to try to educate the general population about this and physicians.
And that probably has helped with survival rates, I would assume?
Yeah, every 3 years, the American Heart Association does a national survey of women randomly selected by a phone random digit dialing.
Okay.
And they survey about 2,500 women. And what they have found is since 1997, where only 30% of women knew that cardiovascular disease were the leading causes, now it's 56%. So we've surpassed the half mark.
Well, education, right, is the first step there. Doctor, let's talk about the risk factors.
There are several risk factors. They're all fairly well known. High blood pressure, hypertension is one. Elevated lipids or hypolipidemia is another. Diabetes is actually not only a risk factor, but it's actually considered the equivalent of having coronary artery disease.
Oh, wow.
And cigarette smoking. And then there are two that are not changeable: age and family history of premature heart disease.
Okay, and what happens at menopause typically for women?
At menopause, women actually have about a 10-year grace period over men in when they develop their heart disease. And when women go through menopause, as the estrogen level goes down, what happens is the lipid panel becomes less favorable. So the LDL, which is the bad cholesterol, starts to rise, and the HDL, which is the protective cholesterol, starts to fall. And then women start to approximate numbers of men in terms of developing heart attacks and strokes.
Let's talk about the heart that you brought with you today.
Yeah.
So people talk about having heart attacks, but where does it actually happen?
Yeah, heart attacks happen in the left ventricle of the heart, which is the thick-walled chamber, which you can see here, which is the thick walls. And when we talk about coronary arteries, the coronary arteries come off of the aorta, which you can see right here, the red arteries. And they look very small, but actually you can see how easy it would be for a clot to clog.
Because they are so small. Well, let's talk about what women can do to make sure they don't get heart disease.
The most important thing is knowing your numbers, is learning what your blood pressure is, making sure you see your physician, and if your blood pressure is not at goal, to address your lifestyle and use medications if you have to. Knowing your cholesterol numbers is very important, not just the total number, but the breakdown, the bad cholesterol, the good cholesterol.
Is that something you should do once a year, or how often would you recommend?
It depends on your age. In your 30s and 40s, once a year is adequate. As you hit menopause, it should be more frequent. If you find out at 50 your numbers are good, having a yearly physical is fine. If your numbers are starting to rise, then it should be more frequent. Also knowing your blood glucose is important, and your body mass index.
That's a scary number sometimes. People don't like to know that.
Right.
But going along with that, exercise goes hand in hand, right?
Absolutely. As you find out what your numbers are, if your cholesterol is elevated, if your blood pressure is elevated, if your blood glucose is elevated, exercise is one of the best ways to work on all those things, as well as altering your diet.
Well, we're going to be talking to Catherine in a moment about a healthy diet, but how crucial is it to have a natural, balanced diet?
Absolutely important. Obviously, altering your carbs to affect your weight favorably, high protein, low fat, low salt.
These are things most people know, but probably should put into effect, right?
Hard to do. Very hard to do.
Not smoking, that seems like an obvious one, and reduce stress.
Right.
Any tips for doing that?
Yoga's a great way to do that, and just trying to manage your day-to-day life the best you can.
Good advice there. Okay, so let's talk about symptoms that might signal that a woman is having a heart attack.
Yeah. Everybody or many people understand that women can have different symptoms, what we call the atypical symptoms. One message that came out of the survey that I was talking about a little bit earlier is that people have lost sight of that chest pain is actually still the most common symptom for women and men who are having new cardiac events. We usually split the symptoms into two different categories. If they're acute, meaning you think you're having a heart attack right now, it's an acute or immediate onset of chest discomfort that does not go away. People describe it as pressure or tightness. It can radiate down the left arm up to the jaw, and then you can have other associated symptoms like shortness of breath, sweaty feeling, palpitations, lightheadedness.
Is there
nausea.
a certain time when a woman should go to the emergency room rather than the doctor? Or?
Yes, if they have an acute onset of
like
those
you said,
symptoms,
okay.
yeah.
Well, let's talk about cardiac testing at Yale-New Haven Hospital. What's available?
There are a wide variety of tests. If people think they're actually having a heart attack, we check something called cardiac enzymes and an electrocardiogram to try to determine if they are. If they're not, we usually go on to do stress testing, and there are 3 different types of stress tests.
And when should a woman actually get that stress test?
If they're having chest pain, in the acute setting, if it's chest pain and they're not having a heart attack, right afterwards. If they're having chest pain that isn't like that and they go to their doctor, that's a good time to check an EKG and then a stress test.
Very good. Such great advice here. Well, listen to your tips, doctor. And for more information on Yale-New Haven Hospital, go to ynhh.org. And you could also find information on Yale-New Haven Hospital's Facebook page. Everything you need to know there. And also will be linked up on our website, WTNH.com. Coming up next, we'll head over to the kitchen where we're going to make a heart-healthy recipe when Connecticut Style returns.